Hi guys, I'm Dr. Jacqueline. I'm a general dentist with Dental Design Singapore. And today we are going to talk about freehand composite bonding. What is freehand composite bonding? It's a term that is exactly what it describes. Composite is basically a type of filling material, what lay people would call a white filling. So it's basically a kind of plastic material that is soft. You can mold it into like any kind of shape that you want, and then you harden the filling material by shining a light onto it. So for all my ladies out there, if you do like gel nails, you have had like composite applied but to your nails. So when we talk about composite bonding, it's usually done to address like really minor imperfections. So maybe the edge of your tooth is worn down slightly, but the rest of your tooth is in pretty good condition, and you want to just repair that little chip at the edge. So that can be done with composite bonding. And of course, the word freehand means that your dentist basically applies the composite and shapes it in your mouth, solely using their skill and their eyes and all their years of training and experience. What is the difference between freehand composite bonding versus other treatments like composite veneers or ceramic veneers or even crowns? So as I've described, bonding just that tiny fragment of the tooth that is missing using composite to reconstruct it is composite bonding. So the big advantage is that you don't add material where it is not needed. It's very suitable for maybe younger patients or patients who have like really nice teeth, but certain parts have gotten chipped or worn down over time, and it does not really involve like any drilling of your teeth. Usually these worn or chipped edges are maybe very jagged or have sharp edges, and these need to be smoothed off. But apart from that, the original tooth is left mostly untouched. So it's a really minimal kind of treatment. Most of the time, patients can have this treatment done even without local anesthesia because you're not like drilling into the tooth. If you compare that with a composite veneer or a porcelain veneer, both of these treatments involve covering the visible front part of the tooth with a material. So it could either be composite again, which is the same as what you use for edge bonding, but you use a lot more of it to cover the front of the tooth. If you're doing a porcelain veneer, it would be porcelain covering the front part of the tooth. If the patient has a tooth that's a bit discolored, or they really want to create like very dramatic changes in size or shape, or the tooth itself has been filled many times before and the fillings are starting to discolor or stain at the edges, then edge bonding or composite bonding is not really suitable. You still have to reconstruct the missing parts of the tooth that have been replaced with filling material, and a veneer of some sort, either with composite or porcelain, would be more appropriate. And the difference between a veneer and a crown is that the crown will encircle the entire tooth. So basically you can think of it as a veneer is half of a crown. Crowns are more suitable for teeth that have been more extensively damaged, or if you have an existing crown, the only way to improve the appearance of an existing crown is to change the crown for a new one. So if you have decided that composite bonding is for you, how would the treatment process go? The first thing to do is to get a proper consultation with a really good examination, especially of your bite, and proper records. So usually this will mean like different photos of your teeth, of your smile, of your face, and probably a scan of your jaw as well. The analysis of the bite is really important because that is the key to having a really long-lasting result, especially because most of the time the teeth have worn down in this very specific way because of maybe like certain habits. So patients may bite their fingernails, or they may chew on pens or things like that. Those habits need to be identified, otherwise it's going to cause the composite material to fail and wear down in the same way as the natural tooth did initially. There are also some patients who grind their teeth in their sleep, or maybe they have teeth that are not perfectly in alignment, and that can produce uneven stress and pressure on the teeth. So if one of the teeth has gotten worn down and you build it up, it might produce uneven pressure exactly on the area that has been treated with the bonding, and that bonding will just either break off or wear down really quickly. So I feel that diagnosis is really the most important part of the whole treatment. Very often I do composite bondings for patients who are going to start orthodontic treatment. So if they're going to get braces, because their teeth are not straight, so they have very uneven patterns of wear, and we want to make sure that we get the tooth into the correct size. before we start moving it, so that as the treatment goes on, we can see whether we have moved the tooth into the correct position to end nicely with everything nice and straight. And it also helps us to bond our brackets more accurately. So once your dentist has determined that you are suitable for composite bonding, then usually, as I said, the rough edges of the teeth need to be smoothed. Adhesive, which is a glue, is applied to the surface of the teeth, and the missing part of the tooth will be reconstructed in that composite or plastic material. And then your dentist will make sure that the color will match your original tooth, so that at the end of it, it shouldn't look like you have a bonding done to the tooth. It should just look like the tooth was like that all the time in your mouth, and it should look really natural. Most of the time, I will split this into 2 visits. So the first visit will be for the actual placement of the composite material with a bit of rough shaping at the end. And I will usually get the patient back on another day to check that we have chosen the right color for the material. If the color is a bit off, you can always just remove some of it and re-layer it to get a better color. And then we will do the final polishing. So now that you've had your composite bondings done, how do you look after them? So there isn't really too much that you need to do or worry about when it comes to looking after your composite bondings. Of course, it goes without saying that good hygiene is really important, because if you let a lot of plaque build up on the composite material, it roughens it, so it loses its shine, and basically the plaque will start to eat the composite. You should brush and floss your teeth as per usual. I would probably avoid whitening toothpaste because they're quite abrasive, so they may damage the composite material. It's normal for the composite to lose a bit of the gloss just through daily brushing, but your dentist can always shine it up for you again when they see you for your periodic cleanings. I would also avoid using your front teeth, especially to open things like potato chip packets. Avoid nail biting or chewing on pens or things like that, because all of that can accelerate the wear of the composite material. Now let's talk about some frequently asked questions. So I've covered some of them previously, but a lot of times patients are concerned about whether the composite will match their real teeth, and the answer is most of the time we get really, really close. Like I said, sometimes for patients with teeth that have very unique colors or different features, it might take a bit more effort to get the color right, make sure the surface texture is correct, but you can go through like a few revisions and tweaks to make sure that everything looks as how you want it. If, for example, you change your mind and you don't like the bonding, you can always remove it with really like no damage or change to the original tooth. You can also, for some patients, after a few years of having just bondings done, they may want to upgrade to, for example, like porcelain veneers that can be done with no issue as well. So I hope that answers all your questions about freehand composite bonding. It's a really nice way to rejuvenate a smile, especially when you pair it with teeth whitening. Your dentist will need to do a proper analysis, especially of your bite, to make sure that you don't have any bite patterns or habits that can cause your composite bondings to fail prematurely. It's actually one of my favorite treatments to do because I feel it's minimally invasive, but you get these really subtle changes that can make a big difference to the smile overall. So if you want to know more, and if you want to know whether you are suitable for freehand composite bonding, I look forward to seeing you here at Dental Designs. Bye!